man.
Good morning, Mrs. Fuentes. How are you today?
I'm great.
Good. I'm glad to hear it. Ms. Fuentes, my name is Salley, and I am a nursing student with OSUIT. And if it's all right with you, I'll be performing your physical assessment today.
That's fine.
Good. All right, I'm going to start off by washing my hands real quick. So wash, wash, wash. All right. Now I need you to go ahead and tell me your full name and your date of birth, please.
Salley Fuentes, 6/13/90.
Good. All right, we're going to start off by inspecting your head, your face, and your scalp. And basically what I'm looking for is any signs of lesions, infestations, and basically verifying symmetry, okay? So I'm going to start off. All right, I don't see any signs of infestations or lesions, and everything appears symmetrical. All right, I'm going to move on, and I'm going to palpate your auricles, okay? And just let me know if you feel any pain or sensitivity, all right? Tragus, anything?
No.
All right. Now I'm going to inspect the inside of your ears, all right? And basically what I'm looking for is any cerumen blockages, any discharge, any kind of lesions or abnormalities, which I'm not seeing, all right? From there, I'm going to move on, and I'm going to palpate your sinuses, all right? And I just want you to let me know if you feel any pain, sensitivity, or pressure. So this is your frontal, this is your maxillary. Anything?
Nothing.
All right. Now I'm going to move on to your eyes. And the first thing I'm going to do is I'm going to verify that your eyes and your eyebrows are symmetrical, which they are. All right. And now I'm going to inspect your conjunctiva and your sclera. So I'm going to pull down on your lower eyelids, and you're going to look up for me, okay? All right. And I'm just checking to make sure your conjunctiva is pink and moist, which it is. Now I'm going to pull up on your upper eyelids, and you're going to look down for me, okay? And I'm just verifying that your sclera is white and moist, which it is. All right. Now I'm going to check your pupils for perla. All right. And I'm going to start by shining my little light into your eye. So. Now I want you to follow my pen to these positions, please. All right. And lastly, I want you to take a look at my pen, look at the wall behind me, and then look at my pen again. Okay. All right. Your pupils meet perla, which means that they're equal, they're round, they're reactive to light, and that they accommodate. And that's what we want to see, okay? All right, actually. Now I'm going to move on, and I'm going to inspect your nose. All right, and I'm going to start off by making sure it's midline, which it is. Okay, now I want you to lean your head back slightly for me because I'm going to inspect the interior. All right, and I'm looking to make sure that your mucous membranes are pink and moist, that there are no signs of lesions or abnormalities, and I'm also making sure your septum is midline and not deviated, which it is not. All right, from there, I'm going to have you flare your nostrils for me. So go ahead, just blow out both sides. Okay, good. Your nostrils flare symmetrically. And now we're going to check your patency. So I'm going to cover one nostril, all right, and you're going to blow out the other side. Okay, and then we'll do the reverse. So, good. All right, your patency checks. All right, now we're going to move on to your mouth. All right, the first thing I'm going to do is I'm going to look at your lips and verify that they're pink and moist, which they are, and also that there are no signs of lesions, which they're not. All right, so now I'm going to have you open up nice, big, and wide for me. Okay, and I'm going to inspect the inside. I'm making sure your gums are pink and moist, your tongue is pink and moist. I'm making sure your palate and your soft palate, which are both pink and moist and free of lesions, which they are. I'm also making sure that your tonsils are intact, that your uvula is intact, and that both of them are pink and moist, which they are, and that your teeth are white and in line with no signs of caries, and I don't see any. All right. And also that your mucous membranes are pink and moist, which they are as well. So, all right. Now, after that, we're going to move on to your neck, okay? And so I want you just to take a look up in the air for me. Good. All right, and I'm starting by making sure that your trachea is midline and intact, which it is. All right, go ahead and move that. Now I'm going to palpate your thyroid gland, and I'm checking to see if it's enlarged, okay? Just let me know if you feel any pain or sensitivity, okay? All right, it's not enlarged. Anything?
Mm-hmm.
Good. All right, from there, I'm going to auscultate your carotid artery, okay? And basically, I'm listening for any signs of bruise. Alright, I didn't hear any signs of any breweries. If you had any, it could indicate maybe a blockage or a narrowing of the vessels, but you're clear. So, alright, last thing I want to do from there is I want you to take a quick look to my right, or your right, or to your left, I apologize. Good, alright, now take a quick look to your right. Alright, I was just checking to make sure that your jugular veins weren't distended, okay? Alright, now from there I'm going to move on to your anterior thorax, which is your chest, okay? And the first thing I'm going to do is I'm going to check your skin, and I'm making sure that it's consistent with the rest of your body. There are no signs of lesions or edema, and I'm also checking for moisture, making sure that it's dry and there's no moisture, which there is not, okay? All right, after that, I'm going to place my hands in your chest, and I want you to take a nice big deep breath for me, okay? Good. All right, your lungs rise and fall symmetrically. I'm also noticing that you're not having to use your accessory muscles, basically, which is what we want. We don't want you sitting there going, okay? So that's good. All right, next thing I'm going to do is I'm going to auscultate your lung fields, and there are 8 of them, okay? And basically what we're listening for is any rales, wheezes, crackles, or bronchi, okay? So take nice deep breaths for me. Go. Good. Go. 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 And go. Okay. All right. I got clear breath sounds in all 8 fields. I didn't hear any sound, any indication of rales, crackles, wheezes, or bronchi, okay? Which is what we want. All right. Now I'm going to move on to educating you on the breast exam, okay? And breast exams are very important, especially if you have a family history of breast cancer, okay? And you need to do these at least once a month, every month, all right? And you can do them in the shower, lying down, it doesn't really matter, okay? So if you'll just follow along, you want to raise one arm above your head, and with your opposite hand, starting at your axillary, which is your armpit, you want to go in small concentric circles all the way around your breast, okay? And you're looking for any lumps, any areas that are particularly sensitive, okay? Now, when you get your way all the way around to your nipple, you're going to give it a nice firm squeeze, okay? And when you do that, you're going to be looking for any kind of discharge, right? Now, if you do find any lumps, or if you do find an area that's particularly sensitive, or if there's any kind of discharge, you're going to want to contact your physician and schedule an appointment as soon as possible, okay? To get that checked. All right, good. All right, from there, I'm going to move on to your anterior thorax cardiac, which is your heart, okay? And I'm going to start off by doing a visual inspection of your chest, making sure that there are no visible signs of pulsations, okay? I don't want to see your heart trying to jump out of your chest, all right? And I'm not seeing that, so that's good. Okay, now I'm going to auscultate your heart valves, all right? And we're going to start off to the right of the sternum in the second intercostal space, listening to your aortic. Okay, now to the left of the sternum in the second intercostal space is your pulmonic. All right, just below that in the third intercostal space is your secondary pulmonic, or your Erb's point. All right, just below that in the fourth intercostal space is your tricuspid. All right, and just below that in the fifth intercostal space is your mitral. Okay, and then below that, also in the in between the fourth and the fifth intercostal space, just to the left of the midclavicular line, is your apical pulse. That's the point of maximum impulse. And I'm going to take a quick listen to it. Okay, good. All right. I had good valve sounds in all of the valves, and I didn't hear any signs of any murmurs or dysrhythmia, which is what we want, okay? All right, from here I'm going to move on to your posterior thorax, okay? And I'm going to start again by inspecting your skin, again, making sure it's consistent with the rest of your body, no signs of lesions or edema, which I'm not seeing, and also checking the temperature, making sure it's dry and there's no moisture, which there's not, okay? Next I'm going to do is I'm going to inspect your spine, and I'm making sure that there is no signs of lordosis, scoliosis, or kyphosis. All right, I'm not seeing any. Okay, now I'm going to place my hands on your back, and you're going to take a nice big deep breath for me, okay? So go ahead. Good, okay. And again, I was just making sure that your lungs rise and fall symmetrically, which they do. All right, now I'm going to auscultate your lung fields, all right? And I want you to just take some nice deep breaths for me, okay? Go ahead. Go ahead. All right, and then there's one more over here on your right lateral side, and I'm listening for that third lobe. All right, I heard clear breath sounds in all 11 lung fields, no signs of rales, wheezes, crackles, or bronchi, okay, which is what we want. All right, from there, I'm going to move on to your upper extremities, okay? So you can see your arms. All right, again, first starting off, making sure, checking the skin, making sure it's consistent with the rest of your body, that there are no signs of lesions or edema, which there's not. Checking the temperature, making sure it's dry and there's no moisture, which there's not as well. Okay, so that's good. All right, now I'm going to check your skin turgor, okay, and we're basically not wanting to see any kind of tinting. Okay, all right, no tinting, that's good. All right, now I'm going to palpate your brachial pulses, okay? So just hold still for me for a second. All right, they are bilaterally symmetrical. Now I'm going to palpate your radial pulses. All right, they're bilaterally symmetrical as well. All right, next I'm going to do is I'm going to inspect your capillary refills. I'm going to press down on your nail beds, and we want to see them refill within 3 seconds, okay? Which they do. And I'm also making sure that there's no signs of clubbing, which there's not, okay? So, the last thing we're going to do is we're going to check your range of motion and your joint strength, okay? So, follow me along, if you would, with your arms at your side, all right? This is abduction. This is flexion. This is extension. And this is adduction, all right? Now put your arm straight out for me. Press down on my hands. Good. Press up. Good. All right. Thank you. All right. From there, we're going to move on to your abdomen. All right. So I want you to go ahead and lie back for me. All right. And we're going to start off by inspecting your abdomen and just looking for any signs of masses or bulges, okay? Which I am not seeing, okay? From there, we're going to auscultate the quadrants of your abdomen, okay? And I'm listening for hyper, hypo, normal, or absent vowel sounds, okay? So I'm going to start off in the lower right quadrant. Go up to the upper right quadrant. Upper left quadrant. Lower left quadrant. Okay? All right. Now, I heard good vowel sounds in all 4 quadrants. If I hadn't have heard any vowel sounds, I would have listened for a total of 5 minutes per quadrant before I annotated that they were absent, okay? All right, now we're going to move on, and I'm going to palpate your quadrants, all right? And I'm going to start off lightly palpating in the lower left, or lower right. All right, so basically I'm looking for any signs of masses or bulges. Okay, and I didn't hear any. All right, and now I'm going to do some deep palpations. Again, I'm looking for masses or bulges, and I'm going to start off in the lower right quadrant again, okay? Okay, the upper right, upper left, lower left. Okay, I didn't find any signs of any masses or bulges, which is what we want, okay? From there, we're going to move on to your lower extremities, okay? And again, I'm going to start off by inspecting your skin. All right, and I'm verifying that it's consistent with the rest of your body, that there are no signs of lesions or edema, which there's not, and I'm also checking the temperature, making sure it's dry and there's no moisture, which it's dry as well. Okay, so, all right, next thing I'm going to do is I'm going to palpate your, posterior tibial pulses, okay? So just hold on for me real quick. All right, they're bilaterally symmetrical. Now I'm going to palpate your dorsalis pedis, okay? Which are on the top of your feet. So just hold on one second. All right, they're bilaterally symmetrical as well. All right, now I'm going to check your toes for your capillary refill, and I'm going to be checking to verify that there's no clubbing as well, okay? So again, we want to see them refill within 3 seconds, which they do, and I see no signs of clubbing, which is good. All right, last thing we're going to do is we're going to check your range of motion and your joint strength again, okay? So, all right, so go with me. Okay, this is flexion, this is extension, this is abduction, this is adduction, okay? And I would do the same on that leg. All right, now I want you to go ahead and press down on my hands. Good. Press up. Good. Okay, and then I would do the same on that side as well. All right, Ms. Fuentes, you can go ahead and sit up. All right, with that, that completes my physical assessment. I want to thank you very much for helping me out today. If you need anything, I'll be here for the rest of the shift, so please do not hesitate to give me a holler, okay?
Thank you.
Thank you.